Gut, dann nehmen Sie ruhig da Platz auf der Liege. Sitzen.
With this patient, there is on the one hand a treatment of rosacea in various stages, which can be seen here, and on the other hand, there is a treatment of acne. The diffuse reddening in the middle of the face, nose, and adjacent cheek are caused by extensions of the blood vessels and can be seen here clearly. At the same time, small nodes, papulas, are formed, which can also be found on the cheeks. At first, the cheek reddening is treated with the setting for vessels. Then the area around the mouth is treated. The device is set to telangiectasia's face and thick vessels. The skin is of skin type 2 and there is no suntan. If another type of treatment is planned, these settings may also be changed. This will be explained in detail later on. The big vessels at the side of the nostrils will be treated with a long pulse with 15.7 joules per square centimeter. To reach a clearer result, this value may be increased to 16.5 or 16.7 joules per square centimeter at the nose. It is advisable to use a little more gel to compensate surface irregularities. Areas that are slightly tanned are simply covered and not treated. During the vessel treatment, the handpiece is not pressed on the skin but held only lightly on the skin. The darkening of the vessels can be seen clearly.
Also, 1, ganz locker auflegen, 1, 2, 3.
Then the device settings are changed from thick to thin. This is done directly in the selected program. With 10 milliseconds, the pulse duration is now considerably shorter and the energy density is 12.5 joules per square centimeter. Experience has shown that the nose usually needs a little more energy. Therefore, this setting may be increased by about 1 joule. When treating the middle of the nose, the protective glasses would be in the way. Therefore, 2 wooden spatulas are used.
Die Nase ist halt sehr rund, sehr konvex. 3, 2, 3.
Special care should be taken that any beard hair is covered with a white compress. Otherwise, the hair might absorb the light, resulting in surface burns.
1, 2, 3. 1, 2, 3. 1, 2, 3. Und auch hier wieder abdecken vom Bart, damit die Haare nicht verbrennen. 1, 2, 3. Und 1, 2, 3. Gut.
After the treatment, a clear reddening of the skin can be seen. As a result, the fine telangiectasias is extended to carry off the heat. Within 20 minutes of secondary cooling with a cold compress, the reddening will disappear. The subsequent acne treatment is done with the PR handpiece. The skin type and the degree of tanning do not have to be set again for the same patient. For acne treatment, the default is 2 short pulses of 2.5 milliseconds with an interval of 10 milliseconds and then again pulses for 2.5 milliseconds. The energy density has a standard value of 7 joules per square centimeter, but it is increased for this patient to 8 joules per square centimeter. The Ellipse treatment reduces the sebaceous glands, resulting in a degreasing of the skin. Bacteria are reduced, and papulas and inflammatory changes recede as well. An increased application of gel helps to hit the very thin vessel supplying the sebaceous glands.
3. Ist okay für Sie? 1, 2.
Even the smallest pressure might aggravate the treatment result. Therefore, the handpiece should only be put lightly on the skin without applying pressure. As is clearly visible here, the front and rear end of the handpiece do not have skin contact at the same time when treating the cheek. Therefore, this area cannot be covered with just one pulse, but has to be done twice. Once with contact with the front end, and once with contact with the rear end. Where there is no contact, there is no result. Therefore, covering is not necessary. Wiping to and fro with the handpiece removes air bubbles in the contact gel and thus improves the treatment efficiency.
1, 2, 3. 1, 2, 3. 1, 2, 3. 3. Hol mir noch ein bisschen Gel von unten raus. 1, 2, 3. Und der letzte Schuss. 1, 2, 3.
Wet compresses or the application of a lips cooling gel after the treatment are welcomed by the patients.